I don't know. I think it's this little cloud right there. Yeah, it is. You're good. Good morning, everyone. Welcome. Happy summer. Hope you all are having a great hot summer. I'm glad we've had some relief in the last day. It feels like it's going to be fall soon, but we're not there yet. I'm Melissa Schammel.
It's July.
Well, yesterday I walked out and I was like, oh, it's cool. And I'm like, oh my gosh, it's going to like, no. Like there's still vacations. We still have August. But yesterday I walked out and I was like, oh, I don't want to like just melt into a puddle. So it's nice. So I hope everyone's been staying cool and having a good summer, taking some breaks. I'm glad we have such a packed room today. I know everyone has vacations and competing priorities, so I'm really happy to have a full room. Again, my name is Melissa Schammel. I work at the Community Health Institute Center for Excellence, and I'm the lead for the Prevention Community of Practice. I'm here with two colleagues from CHI, Adelaide Murray and Rekha Sridhara. And also members of the planning team include Jill Burke, Rob O'Hannon, Julie Yerkes, and Beth O'Connell. Today, we are going to be talking about practical approaches to sustainability planning. This was brought up as a topic area that people thought would be a priority. So, and I can see by the room here, it is. So I'm just going to. So for those who haven't been to, is anyone new to the Prevention Community of Practice? This is your first meeting? Great, a couple new faces, welcome. So we meet every other month. Our next meeting is September 11th, so I'm glad that you're here. Mark your calendars for September and November. The purpose of this Prevention Community of Practice is to serve the prevention workforce in an effort to increase best practice knowledge relative to effective prevention, to build collegiality and professional mentoring among those delivering prevention services, to improve communication between and within systems of care addressing substance misuse, and to promote a recovery and resiliency-oriented set of principles and practices. Constructs. A lot to say. There's a few components to this Prevention Community of Practice. It is not just these in-person meetings, which meets every other month for 2 hours. It is also resources and tools that we have on our Prevention Community of Practice website off the Center for Excellence website. Email-based discussion group. So there's a Prevention Community of Practice Google group. If you are not a part of it and want to be, please reach out to me. There's also, if you are a part of it and are not sure how to use it, there's a Google group FAQ sheet on this resource table over in the corner. So, or please email me if you're having any difficulties using that platform. The Center for Excellence also offers technical assistance through the Center for Excellence website. If you have any questions about appropriate technical assistance requests, please reach out to anyone on the center team and we can help shepherd you through that process. So today's agenda, welcome and introductions that we just have gone over. I'm going to go over what we did last meeting in May. We did a prioritization activity where we voted on topics that are a priority to people in the community of practice. So I'm going to go over the results of that. We have two program perspectives. So we've invited Vicki Hebert here and Maura Fitzpatrick to discuss their efforts related to sustainability and how they've approached it. We're going to have a Q&A with them, and just around the room, everyone here has some experience with that, and a wealth of knowledge is in this room. So if you have a perspective or an experience that you want to share, this is the time to do it, but it's also a Q&A with our presenters here. We'll have some cross-sharing on successes, so that can lead into that. The Q&A can lead into the sharing of successes. And then we will have an activity, and in your packets, there's a discussion guide that will lead you through that activity. And we'll wrap up and have evaluations. If we are offering 2 CPS credits for domain 1, so if you are a CPS, we need you to fill out your evaluation and hand it in and have us check off your name. So you'll get that certificate in the mail or in your email. Our objective today is to describe successes and challenges associated with sustainability, to identify the SAPST, Substance Abuse Prevention Skills Training, keys to sustainability, to describe concrete examples for each SAPST keys to sustainability. So I'm going to just go over, like I said, that prioritization activity results. So there's 2 slides here. I just put it on 2 slides because it was like way too small to read. So you can see that the top 5, the top one overwhelmingly was the impact of ACEs on substance use disorder and approaching prevention with a population that has experienced trauma and adversity. So there's a reason why we didn't choose this one for July, because people are on vacation, and we really wanted to be able to have some time to plan this out. So we're hoping that in September, that will be the topic for our September 11th meeting. Prevention strategies and initiatives specific to marijuana. We, as the planning team, wanted to wait on this because there is so much moving with this topic, and there's lots of other opportunities that is provided statewide on the topic of marijuana. So our third was sustainability planning, and so we decided to approach that topic for July, and we thought it was timely with contracts ending and beginning and trying to think about planning for the next year. The fourth one, social determinants of health. So this is a very important and pertinent topic. Who attended the NHPHA training on social determinants of health? So a few people in the room. I would be interested in hearing your thoughts on how this community of practice could expand on that, or how we could kind of complement what was done by the NHPHA. When we were at our planning meeting, that invite had just gone out, so we're like, well, we'll wait on that. But I would be interested in hearing from those who attended that training.
Right now?
I don't know. Maybe not right now. So I see John and Cora and Stacy. Okay. So I'll reach out to you guys and just kind of see. Maybe we can have a phone call. The fifth topic is prevention strategies related to vaping. So we know that that is a priority for this group. And then just as we went on, prevention strategies for young adults, data collection and analysis for program planning, prevention strategies specific to alcohol, prevention strategies specific to LGBTQIA, and ACEs again, but as related to prevention of ACEs, and then prevention strategies and initiatives specific to heroin. Is there anything that's on this first page that people are like, that's not a priority anymore, or we should focus someplace else? What are some reactions to this list? Is it accurate of what the field needs? I'm seeing some head nods. Okay. All right, so our planning team meets about, I don't know when our next planning team meeting is, but it's within the next 2 weeks, I think. And we're gonna go over this and hopefully have that ACEs presentation in September. Depends on speakers that we can get for that, and some subject matter experts on ACEs. And we'll be hopefully have a great presentation for September and November as we move forward.
And also, before we get going to the next topic, well, actually it's summer point. So I think it would actually be very good if everybody, just sort of introduce themselves, that's who they are.
Yeah.
So if we could start with you.
Yeah, let's get a microphone. So there is a couple folks on the phone.
All right, so my name is Jill Burt. I'm with the Bureau of Drug and Alcohol Services, and I serve as the head of prevention And I'm really, really happy to see everybody in the room today, especially the summer mornings. So
Jill, what if we did, everybody stood up and did a stretch too? And you did a stretch to help wake everybody up. So everybody,
That's
when
a
you say
great
your name,
idea.
you do a stretch. Oh. You're welcome.
Connie with the great ideas.
Great idea.
No, like everybody says, like, okay, touch your toes.
We only have 2 hours.
Charlotte Scott, Solrock Coalition for Healthy Youth.
I'm Lonnie Stanley Smith.
Okay.
And like one of these is good, one of these is good, and I work for the Capillary Public Health Network.
I'm wearing a dress, so I can't really go.
Stacy Lazar, work for Capillary Public Health Network. I'm Emma Patton. I'm the program coordinator for the New Hampshire teams. Jackie Baker, prevention in Greater Sullivan County, and I am in population health at Dartmouth. Hi, Bridget Aliaga, also population health at Dartmouth. Hitchcock, SMP, and COC for the Upper Valley. Hi, I'm Ashley Greenfield. I'm also at Dartmouth Hitchcock Population Health. I am the continuum of care facilitator for Greater Sullivan County and the part SMP for the Upper Valley. Elizabeth Duffy, COC for South Central Public Health Network.
Can I just grab Rob for the
Rob O'Hannon, Bureau of Drug and Alcohol Services.
I'm Lindsay Messina. I'm the SMP for the Seacoast Public Health Network. We're along SMP for Stratford County Public Health Network.
Ian Santa Fe, Making It Happen, Greater Manchester. Kelly Gaspa, I'm the Assistant Director of the Partnership for Public Health and also the Director of Behavioral Health Initiatives.
Kim Wade with the Partnership for Public Health, Community Health Educator doing the COC and the YAS. Candace Tucker from the Franklin Marriage Drug Task Force.
Vicki Hebert, Dover Coalition for Youth.
Janet Faluk, Director of the National Prevention Coalition.
Monica Gallant, Director of Prevention Services for the Boys and Girls Club of Souhegan Valley and Director of Community Action for Safe Teens. I'm Rebecca Liz and I'm a high school intern for the National Public Health Department.
Woo! Intern.
Lisa Vasquez, SMP for Greater Nashua Region.
I am Laura Fitzpatrick, and I'm the YAS coordinator for the Seacoast Public Health Network. Good morning, Karen Kirsting, Executive Director of Outreach Therapeutic Equestrian Center in Goffstown, New Hampshire, and I'm also on the board of directors for the New Hampshire Juvenile Diversion Network.
Welcome. Good morning, everybody. I'm Holly Morris. I currently work for Peer Recovery Support Services, a facilitating organization which is Harbor Health.
Yeah.
Good morning, I'm Mariah Colstring and I work for the North Country Health Consortium up in North Country. And I'm specifically the Drug Free Communities Project Coordinator for the Woodsville and April Coalition.
Scott Folsom, therapist for Monadnock Family Services and Student Assistance Counselor.
I'm John Lieutenant, I'm the COC for Greater Public Health.
My name is Sue Sentner, SMP lead for South Central Public Health Network.
Hello, I'm Desi O'Corey, and I'm intern for the Division of Public Health.
Julie McNair-Kia, Director of Counseling, Union College, and YAS coordinator.
Hi, Rika Srihara,
It doesn't feel like it's on, but.
Assistant Director of the Center for Excellence Project at the Community Health Institute.
Susan McKeown, I'm a retired nurse practitioner and a facilitator for the FASTers Family Support Group at Action for Families with Loved Ones Substance Use Disorder.
And on the phone, we have Emily Shanahan, Outreach Coordinator at KV. Hi, Evelyn.
Thank you. Thanks, Jill. I think that's good. I know there's some new faces for me in the room. So thanks, everyone, for introducing yourselves. So I'm going to dive into the content of today's meeting, and we wanted to have some frame around sustainability. And for those who know Katie Shea Morgan, before she left to Kansas, I pulled her in and I said, what frame do you think we could kind of wrap our heads around? So she had suggested the SAPST keys to sustainability, and you can see them listed here. The first one is community support, and community support refers to cultivating community buy-in for prevention and promotion and the positive outcomes they achieve. The second one is organizational capacity, and that refers to ensuring community organizations have the necessary resources and infrastructure to engage in prevention activities and achieve positive outcomes. And effectiveness is referring to ensuring that systems are organized and aligned to achieve positive outcomes. So we are going to frame the presentations today on kind of how those three keys are reached, and then also our discussion after the Q&A and presentations will be kind of relate back to these three keys to sustainability. So I am going to invite up, I'm going to give it a minute. I'm going to invite up Vicki Hebert from the Dover Coalition for Youth to share her experience with sustainability planning. Here, I'm gonna let you, and I'm gonna.
Yeah, I can get started.
Yeah.
So I just want to make it clear that I do not consider myself an expert in sustainability. I just wanted to sort of share our experience, our case study. Some of our success in sustainability was simply luck and timing. And then some of it was a lot of hard work and strategy and thinking ahead and really being strategic with some of our funding and decisions that we made. So just sort of a little bit of background on the coalition. So the city of Dover is our fiscal agent. They have been our fiscal agent since we were founded back in 1992. And partner there. And they assigned the police department in our community to sort of be the agency within the city that was responsible for the coalition. And at the same time that the coalition was developed, we developed Dover Youth to Youth, which is sort of our sister organization. And some of that was luck, some of it was a strategy decision to really brand the two organizations separately. Some of it is that youth can do some more progressive, edgy stuff, and we wanted them to have their own name, brand, and identity. But really, they're a member of the coalition and by far the most active member. So looking at the coalition structure, we have an advisory board that meets quarterly right now. So it's 12 to 15 or so adults in the community. So tying into the DFC 12 sectors, we make sure that they're all represented. And then from that advisory board, we have myself as the only full-time paid staff. And then we have two additional 32-hour-a-week staff that work specifically on Youth to Youth and our youth empowerment efforts. So from there, we have a variety of coalition work groups and then our youth empowerment teams. So currently we have 70 students that are divided into 4 teams, and that's the structure of our Youth to Youth empowerment program.
So the computer's frozen, but everyone has slides in their packets, and I'm going to continue to problem solve.
So the next slide in the packet is sort of our history of funding and some of the key decisions. So like I mentioned, we started in 92, so we've been doing this for a long time. But we didn't have our first DFC grant until 2001. So we were really founded with a very small tobacco prevention cost. We get a variety of different small community donations from these local civic groups. So there's a lot of community support for the program. When looking at organizational capacity, the city of Dover is a huge asset to us. Just all of the services that we have the ability to access through that partnership and that fiscal agent. We have a lot of in-kind support. So some of that we were able to build up through our DFC grant, having to get to that 150% match. But for example, our local radio station, they have an agreement with us where when they can't sell ad time, they'll play some of our PSAs for free. So the in-kind value of that is huge, and it gets our name and message out in the community as well. We rely heavily on interns. So some of them are just UNH interns that find us in their catalog, but we also work with our youth students to provide them with intern opportunities as well. So if you have students at UNH that are in an internship class, we try and scoop them right up to come back and work with us as well. We have, like I said, 70 students involved. So that's a huge volunteer base for us. So when we had our DFC grant, if you calculate their volunteer time and everything, we have over $5,000 worth of volunteer time each year. So that just increases our capacity to do a variety of things. And then we did a lot of assessment on, you know, how are we being cost effective? How can we make sure that we're using our resources strategically? And then the last one is effectiveness. So I talked earlier about that evidence-based status, and really having that to hang our hat on is significant in sort of convincing people that we are effective. We rely on YRBS and evaluations and everything, and sort of the success we've had with the toolkit and everything. But the other thing that I wanted to sort of end on and share is that it's not always data that we're using to share our effectiveness. We also work really hard to collect testimonials from members and students that can really share the effectiveness in a different way. So I just wanted to end by reading a short testimonial from one of our students that really sort of shows how we can have an impact beyond just reducing 30-day use or all of these other measures. So this student said, when I was 5 years old, my mom was arrested for driving under the influence. When I was 7, I spent a night in foster care because she took me out of state and got too drunk to drive us home. When I was 8, she got another DUI, resulting in loss of license. I couldn't have friends over because I never knew what kind of state she'd be in. I couldn't go anywhere because I was embarrassed to explain why my mom couldn't drive me. I remember being so angry with her. I didn't understand why she couldn't just stop drinking. I didn't understand why I wasn't enough to make her quit drinking. Why wasn't I enough? Youth to Youth taught me that alcoholism is a disease. Through the presentations and speakers, I was able to understand addiction and all of the factors that influence people to drink. My mom used alcohol to self-medicate, and by growing up with her, I was learning that when people are upset, they drink. Without Youth to Youth, I may have never learned that behavior isn't normal. Youth to Youth gave me the opportunity to sidestep what may have been a very dark future and to help people the way that Youth to Youth helped me. The confident person that I am today is a direct result of the support that I had from the amazing people at Youth to Youth. I've been so lucky to learn skills, make lifelong relationships, and become a successful leader through Youth to Youth. Youth to Youth has taught me that I am enough. So I think that those stories and those testimonials are so much stronger than any of the data that I can pull out. So really thinking creatively in terms of how we're trying to prove our effectiveness. So that is all that I had. I'm going to turn it over to Mara to share her sustainability story, and then we'll answer questions after.
Good morning, everyone. Thank you, Vicki. That was very touching, the last testimonial you read. I'm Mara Fitzpatrick from the Seacoast Public Health Network, and I am definitely not an expert on sustainability. I am going to talk specifically about sustainability in terms of the program that I work on at the Seacoast. And I'm YAS coordinator, so I am going to talk about what YAS.
Tell us what YAS stands for?
Young Adult Strategy. Young Adult Strategy
Oh,
Coordinator. I'm sorry.
thank you.
Yeah, there's a couple new people, so it
Great.
helps to, do the
I'm not new
acronyms
and I
out.
didn't know it,
Yeah,
so.
No problem, no problem. Okay, so, whoops. Uh-oh. Oh, that's the end of you. Okay. So there we go. Okay. So, like I said, I'm from the Seacoast Public Health Network, and our funding is basically for this particular program, the BJAS grant, the Partnership for Success. And the study that they did, I don't know, maybe we don't all know this, but was the voice of young adults. And the output from that study, and I like what it says down here at the bottom, the participants, the 18 to 25-year-olds expressed concern about jobs, college, transportation, housing, affordability, depression, anxiety, and how to cope. And how to cope, if we can learn that, then a lot of these other problems get solved, right? Okay, so I just want to talk a little bit about our program. Our program is an evidence-based program. It's called Team Resilience. There are two components to it. There's the resiliency component and the health consciousness component. And the author of it is Dr. Joel Bennett. It's evidence-based. Those are the important things, customizable, and it's approved by SAPST and the Surgeon General. And I'd just like to talk a little bit about my program, the program that I don't know if these slides are in the right order. All right. Just because whenever I go out and talk about anything, when I talk about my program, I don't know who's in the audience. So that in itself can build sustainability, right? So the objectives of Team Resilience and Health Consciousness are to identify the effects of stress, not coping well, and how to identify stress as a risk factor for things like absenteeism, accidents, mistakes, negative well-being, and unhealthy habits, particularly at work. Okay, so my slides are a little bit out of order, but these are the things, what we do in our program is we want to teach people how to improve their coping skills without doing this. Okay, let's see. I know that we're a little bit behind, so I'm going to move along a little. Does this look familiar to anyone? No? It's no. Is anyone under stress today? You can raise your hand. Is anyone under stress today? So there is a handout here, and if you take just 1 minute and follow the directions here, let's just do this little activity. Let's see. Okay, so you're basically going to rate each dimension of life, and then just connect them, and draw a shape that connects them. And it should really just take 1 minute.
Do you need one?
I don't know. There's extra copies of this.
I found it.
There's extra copies.
Sure.
Oh, that's okay, no problem. No, okay, good.
Technical difficulties with computers.
Oh, okay. Thank you very much. That'll be better. So just on a scale from 1 to 10, you could circle a number for each component there, and then connect them. And we'll see if they still look like, is it an octagon or a hexagon? It's hexagon?
Six.
So anyway, this is just a little icebreaker to give you an idea of some of the things we do in our program. And just to, you know, the more your figure looks like a hexagon, well, that's good. And if it doesn't, well, maybe there's a couple of things you need to take a look at.
I think it's good to look at this over time.
What's that?
I said, I think it's also good to look at this over time.
Absolutely, absolutely.
Right.
So,
Almost there.
no problem. So, as far as sustainability goes, I like to do something like this when I'm talking to a group so that they're gonna remember me, right? You never know who's in the room, and you never know what kind of relationships are gonna build into the success of your program. There we go.
Did you press the button?
There we go. Okay, and that goes with the activity we just did. Okay.
Sorry about that.
No, no problem. No problem. Okay, so like I said, there are two components to our program, and I think we spent a little bit too much time there. So let's move on to, come on, there we go. Okay, so the young adult strategy for our program, we initially chose to focus on the hospitality industry. And we hired a consultant and we became certified in our evidence-based training, which is resiliency training and health consciousness training. We developed an approach in marketing materials, and we identified collaborators that we'll be working with in the community, such as Safe Harbor. I see Celeste is here from Raymond Coalition for Youth, Austin 17 House, which is where we hired Lindsay from, and the Recovery Friendly Workplace. And we identified champions, not only champions for funding, but who can proclaim the good things about our program. And so here, as I mentioned, are some of the collaborators that we work with. Organizational capacity. So some of the things that we have done with our program is to make sure that we have champions in the community. And as it turns out, one of the champions that we have come to know is people in the Recovery Friendly Initiative. So we are actually training some of the Recovery Friendly advisors. We are paying for them to be trained in our program to help build sustainability. We also train ambassadors. So when we go out and do our trainings in certain businesses, we might find people who are particularly young adults who are particularly involved, say in the workplace that they're at. And we would take them and give them special training, special ambassador training. We also we don't anymore, but we had an independent consultant. And we have interns. We have interns that we have trained. Lindsay was once an intern, I think, with us, and Brian. And we have a couple of other interns, right, Lindsay, that we're training with team resilience and health consciousness. Yep. And so we also are training 2 of the Recovery Friendly advisors to build capacity. So that is going to go a long way So when they go out and speak about what they're doing, they're also going to know exactly what we do and help to build capacity that way.
Lauren, I know she had Safe Harbor on there as one of your collaborators. Are you training people in the recovery community itself to do some of this capacity building?
We absolutely are open to that, absolutely. We're footing the bill, right? So we put the bill to pay for the training. And that is one of the creative ways we use our funding. So yeah, I mean, that's something we could talk about without a doubt, without a doubt. The program itself, it is evidence-based, it's customizable. They're approved by SAPST and the Surgeon General. And I'm really big on two things. And I got a little bit thrown with my whole little presentation here. But marketing and program evaluation, I think are two really, really important components to sustaining a good program. If you take a look at, so here is some of the, this is an example of an evaluation that goes back to a client after we give them a training. And you can see in your handouts, I just put in there the sample training about the evaluation, the pre and post that we use, just for you to take a look at. And so this data is collected and it informs us to make our program better, to make changes. Again, this is something that we hand back. This is one from Dunkin' Donuts that we hand back to the client to let them know. And we collect this data too, so that we know how to change our program and how to improve it. So the first year, we learned that the hospitality industry itself is kind of a tough nut to crack. And there's a couple of reasons for that. The culture of in the hospitality industry is a little bit, well, a lot conducive to substance misuse. And it's not that we're giving up on that industry, but we're going to go and look at other businesses as well. And on the Seacoast, we have a very limited season. So, and I'm giving you this background so that I can explain to you why we made changes. We also learned that we had two distinct audiences, and maybe we should change our approach. So the two distinct audiences are not just the young adults, but it's also the business owners and managers that we had to address. So some of the things that we changed, and I think that, you know, data and experience informs change to progress so that we can sustain our program. So here are some of the things that that we take out of the components of what makes a good sustainable program. So let me see, I just, not just about funding, search for potential funders outside the norm. So we're not just looking at grants, we're looking at champions in the community. There's one individual in particular in Portsmouth who we've approached and we're hoping to approach in terms of funding. Network of stakeholders, like I already mentioned, we have a network of stakeholders. Creative use of resources. We're also using our resources to train others, like our interns and people in the recovery-friendly workplace community. Redefining our scope. So instead of just focusing on hospitality, we've learned that we're going to focus on businesses, and Lindsay's going to do some focus on schools with the same program. And continuous evaluation, feedback from trainings, partners, champions, and Dr. Bennett himself, who is the author of our program, who we continually go back to and talk to about what we're doing. And he helps us as well with our evaluations. And building momentum, I think, is really important to sustainability. So on October 7th, we're going to have a workshop. We're bringing Dr. Bennett here, and you're all invited to come. And he will be doing a little bit of a symposium for us. So staying in the limelight, having good marketing, and evaluation, I think, is important. So I also put in your little packet there, if you go to sustaintool.org, this is just a nice tool that I found useful. And there's an example of a sustainability report there. And
Is it called sustaintool.org?
yes. And you can take a look at that if you like and evaluate your own program with this tool. So, yes, that's it. Thank you.
Thank you so much, Lauren, and thank you, Vicki. I'm gonna give one mic to them, and then I'm gonna open it up to the floor. This is an opportunity to ask questions about their experiences, to share your own experiences and successes, or ask questions to the whole group. Has anyone experienced X? Just hoping to open the conversation up to the whole room. If there's any questions, I will.
Hi, Karen Kirsten from Upreach Therapeutic Equestrian Center, and I guess I wonder from the two of you as well as others in the room, how many of you have staffing that's allocated to fundraising, development, marketing, branding?
Seeing one, two.
So I would question as to, obviously, in creating sustainability, how important is it to be able to have staffing dedicated to those component pieces? Because I know we're so heavily program focused and program delivery focused that sometimes we don't have the resources to do all the things that we recognize as key needs.
I can answer that I spent a lot of time. I think I'm a graphic designer, but I'm not. And I've spent a lot of time, creating brochures and flyers and doing a lot of the marketing piece. And that's fine with me, but yeah, it would be, and we have folks who have helped us with workshops from CHI, JSI, with marketing. But it's not just, and oh, by the way, I think it's really important. I think it's a very, very important component. And I think you're right, we are program heavy, and I think that it's something that it would be good if it was addressed. That and the evaluation piece. I also think that from where I sit, so the young adult strategy is 10 of them in the state. There's 13 public health networks and there's 10 YASs. And I've always thought it would be really nice if there was some cohesion to the marketing of all of those programs, because we all do different things, but we
leverage the overall brand.
Exactly, to brand it. I have a sales background and that's exactly.
Any other comments, questions from the room? Come on, I know you guys have some comments.
I actually have a big voice, so.
Okay.
Just a couple things. One, just a comment. I always think from a higher ed perspective, and how to find bargains. So even just to do little, you talk about branding and advertising and marketing, we utilize our business program for students. And then we have master's programs. So we're actually trying to start to utilize our master's programs. And that can be part of an internship. And then it's kind of a win-win. And also we're marketing also to young adults, right? So why would we want our young adults to be our marketers? So that's just something for folks, even in this room, to reach out to your local universities and colleges to find out if you want to do that kind of work, because they are looking for internships. And it is creative, and especially in the healthcare industry, it is a growing industry. So there's ways to kind of combine that. That's the side note. But then my question was for Dover is how, so the in-kind support that you're receiving, is it in-kind support from either the city of Dover or from the hospital for like your benefits? Do you have benefits such as insurance and things like that? Because those all are funded, right?
Right. So my position is fully funded through grants, and that includes all of my benefits.
Okay.
But in terms of accessing other city services or whatever, there's no cost for us to access those.
I think, Julie, you do make a really good point of looking kind of outside the box for people who are public health majors, business majors, marketing.
you don't kind of reach out to those typical, those schools, and those are the people who have those skill sets. So I think that's really.
And I think looking at your membership, you know, we're fortunate with 70 students that they know social media way better than I do. And getting them to promote some of the things that we're doing is so much easier than me trying to figure it out. Or even just, hey, can you teach me how to do this and increase my skill set so that when they're gone for the summer or something, I can do some of that work.
I can be loud enough. So, with, and I'm gonna say it louder, and I know I'm sitting here talking to you, but so I'm not yelling at you. You talked about the pilot, payment in lieu of taxes. Do you have a template for that? I mean, Nashua has 4 potential medical facilities. We have 2 hospitals, Dartmouth, Hitchcock, and Lamprey, which we're just trying to come up with the proper approach for them. We've established relationships with all of them. We have members from all of those organizations on our coalition, but we just need how do you ask? I know you said the town manager did it. We don't have a town manager in Nashua, but you know, I'm wondering, do you think going the city route would be the best thing?
That made sense for us because the city was our fiscal agent. So it was our city manager and police chief that approached the hospital, and it wasn't a template, but it was sort of starting that conversation and applying pressure on the hospital that, hey, you're expanding, but you're not paying taxes, like help us out a little. And that got us right into their foundation and giving system. So each year we just submit a proposal. So it is a yearly like application process, but there are those conversations and history that sort of say, no, we get that we have to do this.
And most all hospitals are nonprofit.
Probably not necessarily.
No, Southern is.
Probably not the same, and probably not the same classification nonprofit as you are.
I'm sorry?
There's a variety of nonprofit classifications.
Okay.
So probably not the same classification that you are.
I would probably have like.
Yeah. Right. Okay. All right. Thank you.
And it would be the mayor instead of it's the same as the administrator.
Right. Right.
Any other questions or comments from?
So what I heard loud and clear from both presenters was that you know, finding your champions, yes, and finding that integration. Both of you are integrated into that community, but I can't say enough for the participants. And you gave an excellent example of somebody that said, this is how I benefited from this program. You know, we oftentimes talk about this is what the YRBS, or this is what the TAPS, or this is what the, you know, community health assessment is telling us that people say. This is what a person said. And that's huge. And that person is connected to 20 other persons. And so when that happens, that's where you get that support. But there's other factors that we have to start thinking about, and all of you have said it. Now, what do we start talking about in terms of business? Or let's go back. What do we start talking about in terms of culture, our community culture? What do we start thinking about in terms of who do we need to connect with for businesses, tax consultants? Who do we need to start talking to about those connections with insurance, et cetera? So we all have huge, huge programs that are just making an impact each and every day. And so all I want to say to you is in terms of sustainability, this discussion has to continue because there are so many things that impact what we are doing. And so as we think about sustainability, make sure that you are thinking in terms of who are those, what's the next connection? What's that next connection that we need to make? And if it's not us, who is within our circle? Both of you talked about it the best, is that, you know, we didn't know that we had to think about taxes. We didn't know that we had to think about insurance. We didn't know that we had to think about this or that or the other thing. But we have some people within us. So although you guys have the vehicle and although you guys are doing so many fantastic things, make sure that in your sphere that you are making those connections. And did you have a question?
No, I have a comment.
Yeah.
I feel like kind of Dover exemplifies that we need to make prevention, like, kind of bring it back to everyone's job.
Yes.
And when you have, and it might look different for different people, but everyone has a role to play in it. And I think, like, if you look at all the people who contributed in Dover, you see that everyone feels like this is important for my community. It's one of the values of my community, and that's what we need to kind of uphold.
Yes.
That everyone has a part of prevention. It might look different, but they all need to be at the table and figure out what that position or that their role is in prevention. It could be just funding, or it could be participating in kind, or whatever that may be. But I think just like that's the value of Dover. They feel like prevention is a value of that community.
And you know what? Lisa just said everything that I just tried to say. So I appreciate that. Thank you very much. And actually, when I go out to schools, that's the same exact thing. I say, you know, so we have this YRBS and you think it's a snapshot of your school. It's not. These kids are here for what? What is the average day? 5-6 hours. Where else do they go? They're participating in your businesses, they're participating in your healthcare, they're participating in their families. So it's not just us, it's not just you, it's everybody. And that's
Can I
our
put you back
job.
on that? Oh, go ahead.
There's a couple hands. One of the things we've discovered with the Recovery Friendly Workplace Initiative, we've gone in, I should say Mary's gone in with the trainers, et cetera, have gone in. And it's almost like an aha moment for the businesses. And it's been really wonderful to open up because, first of all, I think Recovery Friendly Workplaces, the name is wrong. It should be Community Health Friendly Workplace or something to that effect. Because when we go in and we're talking, it's not just about being recovery friendly. It's about caring about your workers, about suicide prevention, about overall health, all of those things. So when we go into those, that's when the movers and shakers, if you will, at that company are saying, wow, you know, and we, you know, Mary does her little spiel on what we do and how we do it, and they want to know how they can help. So that's one thing that I found with this. It's kicked open the door to businesses in a way that, you know, they're just too busy doing their business and they don't have time. But if it's what's in it for them, you know, the WIFM mentality, they need to know how important it is. And we've discovered that now they're willing to step out and say, hey, prevention is kind of cool, or yeah, how do we do this? And we have more people opening the doors. So that's has potential for building more sustainability, if not in kind, maybe monetarily.
John,
Yeah, maybe going back a couple steps here, but I just really like how working, you know, the in kind, you know, when you go to the store and you see, you know, you buy a box of curry cups and it says Aladdin is coming out of theaters, you know, I mean, it's like they work together to get these things out. And it's like, instead of, you know, somebody, you know, looking for money in one spot, saying, here, you go set up your own office, you go set up your own this, you go set up your own that, you know, getting that sort of relationship is, you know, it works together and you're close together, the communication is better, you know, potentially. I mean, I know it helps in a lot of cases where we're out of the hospital.
Yeah.
You know, that certainly helps, you know. So I just think it's a really, really great approach. And since I grew up, you know, like the youngest of 7 boys, and you know, just mom, you know, went home and dad worked, and I'm cheap, and where you can leverage things and, you know, and make it pay off greater is just huge. So I really like that approach.
So I just want to, come through the recovery person lens, because prevention is so huge and so important, and you all are doing wonderful things in relationships, but connecting, like there's an intersection between prevention and recovery, and we're all trying to do the same thing. And so if you're not, working with your recovery community centers, and you're not reaching those people, because believe it or not, people in recovery are everywhere. They're in those businesses, and they're in your hospitals, and people with addiction are there too. And so getting that communication that you're working from all angles in your community to work together and thrive together is your best bet for success, because there are some great advocates in the recovery community that could really benefit the prevention community and vice versa. So if you haven't reached out to your recovery supports in your community, let me know and I'll connect you. And, it's a bigger bang for your buck all around.
I echo that. I think in small rural communities that aren't like the Nashuas and the Manchesters of that, the recovery community centers are the hubs, if you will, of these local rural communities, and are really kind of know the pulse of the community, whether it's prevention or recovery intervention or treatment, and really kind of give the best, from my perspective, give the best kind of snapshot of what the community needs are in regards to that type of stuff.
You're looking up at one point.
Me?
Yeah. No, you didn't? I made that up.
Sorry. I mean, well, I just assumed me having my hand up, that you assumed I did.
Kelly, you must have something to say.
So I'm just hearing that the other thing to think about when we think about in kind and building those relationships is to think bigger than perhaps necessarily your program. And we all get very program focused. And I think that the turning point for us at Upreach was to recognize that there's a reason we work with horses, but that means we're not good at IT. We're not good at marketing and branding. Those weren't our skill sets. We were program delivery people. So my job was to connect us with people who could do those things well. If we couldn't pay for them ourselves, how do we get them? So there are many companies out there. One of our biggest benefactors is Wirebell Company of America, who provides all of our IT resources. Not only equipment, but hey, everything just went down. I have no clue what to do. I figured out how to reset the router, but beyond that, I'm done. So we can call them. They're an asset for that. We have another organization that provides me with HR advice and oversight. Some of you probably have a lot of that type of connection anyway. We have, again, companies that are willing to do our graphic design work, companies that are willing to help us understand how to do our financial QuickBooks bookkeeping pieces. So I think that thinking bigger beyond just programming may be a way to help build those assets you need that you can't necessarily afford to hire on an ongoing basis. Those relationships take time, and you need to know what you're asking for. And if you don't, sometimes it's great going, I just know I need help at IT. I don't know what that looks like, but I know I need help. Can we figure it out together and have that conversation? And then let them talk, because that's what they do.
We've had really good luck building some of those relationships with the business community by working with our local Chamber of Commerce. They have educational series. So at one point they had a training on how to write a business plan. And I'm like, we really need to figure out, if we're gonna act like a business and sort of sell some of our products and services and stuff, we need to be strategic about that. So when you're sitting in that training surrounded by business people, they're like, well, why are you here? And you just make those connections, and they see that you're invested. And it has allowed us to make a lot of really good connections with marketing agencies and different businesses in town that, oh, you're here, maybe we need to chat more after.
I just have to comment on Vicky. I loved the part about having a membership fee. That was kind of unique, because in social service, we're always used to giving things away, and having them. I loved what you said about soccer. Oh, parents are all over that. Athletics for the kids. This bumps it up to, guess what? not everybody's meant to play athletics or wants to or can, but this is equally as important. And you've got scholarships. We all know there's ways to pay for things, so nobody has to be deprived. That's really good. And selling secure services, that's a lot of work. You've been there since 1992. You got a lot of expertise, and sometimes we sell ourselves short. And I think that it's very good that you've elevated that.
And it allowed us to diversify our funding. So in 2021, we have 2 of our federal grants that are expiring at the same time within a couple months of each other. So that'll be almost $100,000 that we're losing. But it allows us to still have other funding sources that we can rely on so that when we do have that hit, it's not like, oh my gosh, we need to close up shop. And we can take some of that membership fees and put it into a rainy day account if we have other sources that can pay for some of those things. So really diversifying the funding has helped us tremendously.
Kelly?
I do now have a question. I was thinking about that. And Jill, this might be even more directed towards you, but we've had internal, so I'm second in command, as I said, at my agency. I work directly with my board and my ED to identify, you know, some non-traditional opportunities to pull in funding. Fee for service has come up several times and is part of our agency's sustainability. But I wonder in terms of double dipping, what does this look like? So if you're an SMPC where your strategy, substance misuse prevention coordinator in the regional public health networks, if your strategy is to be out there delivering this parent education on vaping, you receive federal block grant dollars to do that work. How do you then charge for that presentation? I don't understand how that works. I don't ethically think you can. So what does that look like? I guess, Vicki, in your agency, how do you do that or collect some of that money for those things that you're already receiving funding to do? And what does that look like in terms of federal block grant dollars?
Good question.
Yeah.
I'm sorry if that was put you in a pickle.
So
And
yes,
I
no,
will email you later, but we've had these internal conversations and I want to make sure that we are doing what we should be doing ethically with this.
So Kelly, is that 100% of your time?
What?
That one parent education?
No, but 100% of my time is funded through the charitable block. You know what I mean? So it's all federal funding that pays 100% of my time. So that one strategy, no.
Yeah, so within your organization, you just need to set up those account numbers. And internally, you need to ensure that your percentage of the time that you are dedicating toward whatever, like if it's Bank of America, I'm just gonna make that up.
Okay.
And they give you X amount of dollars, which is 7%. And then we give you, 30% or 40%. That is how your accounting system needs to be set up. And so anybody that is funded through the Bureau of Drug and Alcohol Services, or anybody, because this is my previous life, I'm happy to help you with how to set up your job codes and your accounting system so that you know the amount of time that you're dedicating is dedicated so that to what you're producing in terms of that parent education.
Right.
So then your question is probably more to the PWIT system and the block grant, correct? So that's a separate conversation that I'm happy to talk to you about.
But for that
Because
first
your
piece-
job code is different than what you're reporting for the Bureau of Drug and Alcohol Services.
Right, and PWIT's aside on that first piece, so Jill, am I understanding right? So are you saying that if, say, 10% of my salary was covered by other things, not federal block grant, not federal dollars, as long as I'm spending that 10% of time on that one strategy, then you could do fee for service because you're not using federal?
Correct.
Okay.
And we've been fortunate where we have employees that are paid for through the hospital, so there's not that conflict. The hospital is thrilled that, we're expanding and getting in other communities and everything. So it's trying not to have everyone on federal dollars.
Right, exactly.
But when we go out and do training, we build in, if we're I have a coworker who's in Kentucky right now with students presenting at a conference, and we charge them his time, our costs, plus so that we're making a little money.
Right.
So we're building in our fee for service is covering our costs and giving us a little extra.
Thank you both.
And city government would be different.
I always know that. I am
So
unique.
you just have to.
Right.
situation. Just the one last thing I want to, and then I do want to hear from others, is that Holly mentioned that folks in recovery, and I do have to say, and Kim Haley's not in the room, she's one of our biggest proponents of the student assistance program. Kim Haley has always said that the people that are movers and shakers for children and youth are the individuals that are in recovery, and those parents are going to move mountains to make sure that their kids don't go down the same path. That's not for all, because we're not a homogeneous group, but so make sure that you're connected to those recovery communities, because those parents just want to make sure that their kids are not going to go down that same path. So.
Janet?
I was just wondering, with the DFC funding, we are just, I mean, we get additional grants, but we're primarily DFC, whether we could actually charge a fee under the DFC grant. It'd probably be a question for our project officer.
I would just do it and let them apologize, like, if it's, yeah, I don't, we never had an issue with it, it never came up,
Okay. So you've done it from the beginning?
I don't remember when exactly we implemented that, but I know we were charging students when we still had DFC funding.
So we can move gears or switch gears to our activity, but is there anyone who wants to share like a unique way that they have? There's been a couple examples of people who have had creative ways to maintain sustainability. Is there anyone else who wants to share with the larger group?
So right now we're working on partnering with a local music festival that happens every year. It's called Jerry Jam. I don't know if any of you guys have heard of this, but it's a celebration celebrating Jerry Garcia and the Grateful Dead. So it's very heavy kind of substance atmosphere there. They've been working towards it's a community. It just happened this past weekend, and there's 6,000 people there from all over the country that show up in Volkswagen buses. And they've been trying
stereotype people.
There is a very heavy recovery presence there. It's the War Rats organization. They follow the Grateful Dead, and there are people that are in recovery that kind of act as a safe place for people that can still attend the festival, but have a safe group of people there. And they've done a lot of efforts in recent years. A couple years ago, I think there was maybe 2 years ago, there was 8 overdoses. Now we don't see that at all anymore. They're really, really trying to be more family friendly. And so we recently wrote them a letter saying, hey, we've recognized that you're making these strides and being more family friendly. You're trying to eradicate drugs there. And we think that we kind of have a similar mission here. And we're wondering if we could partner up. Because every year they donate $4,000 to the town for allowing it to be in that community. So we're hoping to kind of get a little bit of that pot, maybe $1,000, $500, as an annual reoccurring donation from them, which is kind of cool because then it shows that community there, hey, we're in cahoots with this coalition that's working towards a drug-free community, so it looks good for them, looks good for us. So we're working on that partnership. And it's really a kind of a unique thing. It's a little risque, so to speak, because in our community, people are very up in arms about this festival even happening in the first place. So the fact that we're trying to hop on board, it's a little risque, but we're trying.
And can you remind me what community organization you work for?
So I work for the North Country Health Consortium in Littleton,
Okay.
But I have a drug-free community grant for the Woodsville and Haverhill area, and the festival is in our SAU district.
Okay.
It's in Bath. So.
And they probably have the recovery center up there.
They do. They do.
Thank you for sharing.
Yeah.
I was gonna say, so, obviously, I work for New England College, and we received the grant. The primary component that's paying for it is for our part-time health educator. So she's not here today, but I have to give her a shout out. And part of the creative funding that we have been able to do, some of the programs that we've offered have actually been free because we've tapped into local resources.
Henniker Police Department, Henniker Rescue, they have resources in and of themselves. And full disclosure, I have a stepdaughter who's in recovery and very active within her support network and is going to be helping us out in the fall. She presents at an array of places throughout the state, and we're trying to utilize that. Some of the our Young Adult Strategies grant has funded for our Wellness Center team to attend an American College Health Conference. And a small group of us actually presented on how to best utilize little bits of money and make it stretch. And then when we were there, we found out that they are now offering scholarships for attendance. So we're going to be tapping into that. We're hoping to have a graduate assistant and an undergrad student will be working. So I think, but it's a lot of work. I think when we, and I'm sure again, over a number of years, it's a face-to-face. And I think that's what we kind of kept promoting when we presented at the conference is it's taking the time face-to-face. When we're doing larger programming type events, we're tapping in 3 or 4 different departments, even at the college. So the grant might pay 20%, but our student engagement, our athletics, right, and our athletics team is, and our whole athletics program is a whole other beast that we are starting to tackle, especially within substance use. And recently the NCAA has a whole component that's now required. So folks who do work with young adults at a college, university, the NCAA just came out with a, it is a now an expectation that college universities must devote time and energy to mental health. And so I think that's going to be another avenue for people to be able to tap into. So.
Well, thank you everyone for contributing to this conversation, and thank you Vicki and Maura again for sharing your in-depth experiences with sustainability. I am gonna switch gears, like I said, to this group activity. So we are in kind of groups right now. I'm gonna ask Julie, Daisy, and Susan to kind of pull up a chair to one of these tables. And each table is going to discuss one of the 3 keys to sustainability. So in your packets, you have this discussion guide. And each page at the top either has community support, organizational capacity, and effectiveness. And then there's some just some talking points that you guys can talk with each other about what your experience has been, what your challenges have been related to those 3 keys. And if there's anything that you want to make sure that the group knows about after you have this conversation, we do have these little notepads that you can write down on and share, because we will have some time at the end to share if there's anything that came up that you want the group to be aware of or know about. And I just want to make sure that we cover all 3 keys. So I guess there's 1, 2, 3, 4, 5 groups. So who wants to do community support? We'll have 2 groups do community support. 2 back tables. All right. Organizational capacity. You guys will do organizational capacity. And then do the other 2 want to do effectiveness, or pick one or the other? One of you guys have to do organization. We can talk about it. Yeah. They'll do effectiveness, and then you guys can effectiveness or organization. Is that everyone? Does that make sense? We'll have about 20 minutes to talk, maybe a little bit more. We'll see how that conversation goes, and then we'll report out. $15 minutes. I let you guys talk too long. I saw your face. I think I was.
She's been very nice.
So it's defined
All right, I
here as
fixed that.
ensuring they have the necessary resources and infrastructure to engage in prevention activities and achieve positive outcomes. Ways to enhance organization. So I would say some of the best ways and I think building that like volunteer base of those ambassadors, so it's not always right? Because we rely so much on our kids to sort of be space. Yeah. Because I can't be there for that. It's just not it. Right. Yeah. We're starting to get better at that. Yeah. Right.
Yeah.
Oh my God.
I know, I was like, don't you Yes, that's great, definitely. Yes, that's right.
We are one of those, I guess. Maria about that.
You know, it's
funny. There's so many visions. Especially within shore. So I have to be the teacher.
Those are.
Examples of some resources and infrastructure that have led to increased organizational capacity. That is the parity. No. Oh, the physical. Yeah, like. And so like the, that's what I think. Yeah. And getting that buy-in so that they're willing to offer that for reduced cost, free. So you are not just. We're not. And I highly recommend it not to do it. I wouldn't go and create your own. I've done like all these settings and create that visibility. You're like, oh, and with the Dover Police Department. Yeah. And then they yeah. And I know like you work with and that thing. And the first club, yeah. So I think that
And I talked about membership fees, because that's how I sort of implement things, but I've been on boards where it's, you know, respected if you're on the board or donating it's usually, right. So being strategic on who's on your board and setting those expectations. This doesn't even have to be a set amount, like just what, right? But if you can say 100% of our board donates financial documentation, like that, yeah. So your board is different. Or is it, we don't charge our advisory board, but I've been on those boards, so that was good. We're strategic with our board. I mean, it's hard relationships, so like the principal of the school and the captain, police department and stuff like that. But if I were to ask, they would probably. Very high. Yeah. Well, yeah, they right. Even if it's $10, like that's what you can do. Still at the end of the day, right.
So how would you recommend that I'm terrible at keeping money that I am not the market. Go ask me. Bylaws or no?
So when you come,
so you can come to the next coalition meeting and say, I've got this idea.
Like people, yeah. Yes. No, but hey, I've been on other boards.
Yeah. You know, do we want to implement something simple? Yeah. If they're on the board, they're already. Just the whole advisors.
Well, so for example, I can seriously tell you that probably 2 people to our person. So I was you know, what is you know what I mean? It's your numbers right now. So part of prevention is so hard. How are they being recognized?
Yeah, we can do a recognition.
Yeah. Great. We have done trace.
I know.
Yeah. Perception harm. So maybe like
highlight everyone we don't have, not like saying they
Right, right, make those categories.
That's basic. So that's just looking at, okay, you give me $50, that helps me pay for this, and they feel like they're dying. Right. $50 in case group if we focus on that, and then they like it covers 1 meter. Oh, but if you know, and then like, oh no.
Yeah, I don't mean like, yes.
Students get to, which we have a club at North. Responsive, right? Need you to get involved. And actually, the lead, you go to seven, you go to leave it to the back. Cool. Just move down.
So what, once a year?
You're studying public health law college next year?
That's weird. That's right. So you come to South. Yes.
All right, everyone. We're gonna bring it back together. We have about 15 minutes. And let me get my discussion guide before I start talking. So these two tables say community support, right? That's the two back tables. So what came up? I know this is a discussion guide, but what did any takeaways that you'd like to share with the rest of the group? Either.
So we talked about building relationships and trust in the community, and then we sort of backed up on how do you do that? So it was meeting people in your community that are stakeholders and not going to them and telling them what to do or asking them, you know, for something for you, for your own agenda, but listening. That was a big key strategy. Listening to people in your community about what they need, about what they're doing. And I was mentioning I do the appreciative inquiry where there was an open-ended question. Tell me about a really great time when you felt proud of your organization. And so getting people to share about their organization and then just having that communication and teamwork goes. And then we talked about, you know, asking them, who else should I talk to? We kind of had this great conversation. Who else would you recommend I talk to? And then Karen added on that, you know, like one person is now building this capacity, but you need to build that team of people that are building that capacity with you. I think you said ambassadors for the organization so that they can go meet some of these other people and they can gather some of that information or the data and bring it back. And then you can not be in all places at one time. You can sort of be able to have your people out there for you, bringing it back. And then it's important to have that communication within your organization so that everybody's on the same page. So if one person's on vacation or one person dropped the ball with this organization over here, that there's complete follow through so that nobody in your community starts to think that you're not going to follow through and that your reputation gets poor. That trust is continued within your organization with all the people that are working with you. Connecting the dots was what one of us said. Did I miss anything? Anybody want to jump in there?
Some more, just don't, and then learning when to say no. If you do expand all those great resources, at a certain point, you need to say no, because if you're not gonna be able to manage it all.
Right, stepping out of your box, getting a seat at the table can be really great, and it might not always be focused on prevention. So learning with your other community people, we all have an agenda, maybe not pushing your agenda right off the ticker, but listening to what's happening already. And then, you know, at some point, there'll be a time for you to speak up and you'll be more encouraged and included because you've been patient and been showing up and people in the community.
So fostering those relationships.
Yeah,
And-
relationships is the bottom line.
We had very similar themes, so to give other people an opportunity to speak, identifying champions, helping them, leveraging those resources, so I'll focus on the barriers, and then we can pass it on. But we talked about time, lack of capacity, obviously funding is always a challenge, but one thing that came up, I think is really in your face and has been in our region this past state fiscal year was changing priorities and changes in high-level leadership make it really difficult to stay the course with a strategy that maybe a year ago seemed like an awesome thing and you had buy-in, but then everything goes away and it's like starting from ground zero. So that's challenging.
Have you had to, so I know that you've experienced that, how have you kind of tried to patch that?
We identified less traditional, so I'm speaking to a specific strategy that we were really kind of honing in on healthcare providers. And we had to broaden our thoughts and, okay, well, home visitors could do the same thing. They're doing these assessments informally anyway. Let's make it more formal and give them tools to track it and share data. So we had to just think more creatively about who could be doing this.
To fill that gap. Anything else from our community support group?
Being flexible.
Flexible?
Being flexible. Sometimes your community has something that, you know, changes your direction, speaking to what she was saying, you know, changing priorities. Sometimes something happens, like Chester is saying, you know, all of a sudden you have people dying of X drug versus the drug that, you know, you've got this focused campaign on. You have to learn how to switch gears really quick. Or our other example is the DEA 360 came into Manchester. Hello, and that was just like, we're stopped.
Drop everything.
They consumed our city, you know, so we had to work with them, which has turned out very great partnership, but that flexibility needed to change.
So organizational capacity. This group, I know, talked about that.
Go ahead, if you want to start.
So we talked about collaboration is really important for enhancing organizational capacity.
What did you say?
Collaboration is really important.
Thank you.
So
I'll get the mic out.
About, if people have similar values, similar missions and visions, it's really easy for them to work together, but it also makes it so that they can reach more people. So that we thought was helpful to enhancing capacity. Also building a volunteer base, and then enhancing relationships to build those in-kind opportunities.
Yeah, just add being involved in community events so that, you know, your branding gets out there. And sometimes I know it's pretty labor intensive, but one-on-one meetings with community stakeholders and organizations just to get that.
What resources they have.
Yes, see how we can collaborate and work together.
We did too. Organizational capacity. We also said using interns and volunteers, leveraging partnerships. What can we get in kind that will free up staff, as mentioned earlier, and effectiveness, efficiency evaluations, and evaluation programs, where we're at and where we can.
Anything else on organizational capacity?
So the examples of, oh, sorry, I'm going to the next one.
Oh, you're going to effectiveness?
Sorry.
That's great. Did you guys all talk about
No. We were going to talk about examples of
Oh, sorry.
resources
Yep.
and infrastructure.
Sorry, I was going like
okay.
ahead. Yes, examples of resources.
Yeah, we talked about the impact that our fiscal agent has. I mean, Vicki was a great example of, you know, how the police department is huge in the city itself in supporting them. Potentially having coalition members donate or board members make donations. I know that a lot of boards that people sit on, you're expected to donate. Of course, the ask is always the difficult one. Have some type of a recognition event for to recognize people in the community or within your coalition. And then always represent or recognize your donors and sponsors in different newsletters and events that you have. And also letting them know whenever you are, if you are, and we got a little bit off topic, but you know, I guess it all works around sustainability as well, is that when you're asking for donations, let them know what their donations will support.
Yeah, I've heard that as well. It's very compelling. So
a $10 donation would support Students Against Destructive Decision would support one meeting or something like that.
So they know specifically what
Where
that
their money's
funding
gonna
is
go.
going to go to. Yeah. And any barriers?
We just said time.
Yeah.
Priority.
Lack of consistency and sustainability, especially in smaller rural programs.
Yeah. Prioritizing.
Seeing the value of their time and money, or mostly of their time, but seeing the value of it and how it can increase capacity and the importance of that is really important.
I just have a question.
Yeah.
Does anyone have an existing like one pager for your funders or whatever that does that breakdown of, you know, this is what you're supporting and this is, you know, as like a handout?
Looks like Karen.
Yeah. I just would like to see examples of other people's, because we're kind of redoing ours rather than recreating the wheel.
Yeah.
I've been to a number of different events, and always in the center, they always have a flyer. You know, if you have a breakfast or something, in the flyer it says, you know, $10, like she said, does this. And, you know, it gives a list of all of these different things. So
Do you collect those, Pam? Can you scan them and send them?
so yes, I am a order.
Sorry, I would also suggest that if you haven't yet, you consider looking at the New Hampshire Center for Nonprofits.
Yeah.
If you're not members, think about it. If you are, they have a lot of great resources. In fundraising and development, we have an overall ways to give that's very high level. And then for individual campaigns, we then might break out different component pieces of that. For example, not in the example is we do a hay gallon because we need to feed our homes. And we need to spend, you know, $15,000 just for hay for the winter.
Yeah.
So that's a very focused campaign versus a larger annual campaign that's
right.
We may say, you know, 500 provides therapeutic riding for an individual for, you know, 17 sessions.
That's neat that you break it down like that, though, because some funders will want to fund something very specific.
Right,
and that's why I was.
So then there's a menu so that they don't necessarily say no, they just say not this, but this.
Yeah.
Right.
That's neat.
If anyone does have those resources, a Google group is a great way to share that. Yeah. And if you have any technical difficulties with Google group, see me, and there's also the FAQ. I can't stress that enough. It's a great way. Everyone is added to that who comes to these meetings, and it's just a great way to communicate with each other outside of these meetings. Just because we have just a few minutes left, what did the effectiveness group talk about? What came up? Colette.
Yes. The importance of partnerships, evaluation, communication, which I know very well, including diverse perspectiveness, so being aware of the historian, but yet the new people at the table too, include everybody as part of what we're working on. Those were our- And then the next thing, experiencing sharing effectiveness, making sure to share the stories. They can just share an amazing story with us. If we could all find stories similar to that and share. Then taking those stories and sharing them with the people who are providing funding or capacity to be involved with us. They know what they're being part of what they're supporting. Not just sharing data with somebody, but making sure, not just throwing a data slide out there, but making sure we have a narrative with it. Because our youth behavior survey results the last time, our alcohol and marijuana rates looked really bad, but our prescription drugs and heroin went way down. So we have to highlight that and make sure people understand that, and make sure that they understand the perception of harm and risk has gone way down also. So there's not, we need to tell that story so people understand. And then somebody mentioned it, our second and third party ambassadors tell the story. For if someone's out in public in Charlotte, it's telling Stacy the story of the coalition, and I overhear that. I'm not the person telling that, someone else is telling it, and how empowering that is, and empowering people feel.
And also the thank you notes. I think that was a very good point of the recipient of something, whether they're writing lessons or whatever it is, send that, encouraging that recipient to send a thank you note to particular donors.
And then our barriers were diverse perspectives, specifically the legislators were mentioned. As their seniors not actually aware of what's happening on the ground with young people, so they don't understand. Marijuana is just a plant, it's not just a plant anymore. There's many things that are associated with that. Social norms, stigma, perception of harm, and people are just desensitized to the opioid epidemic right now. They don't want to talk about it, they're done with it, and we need to make sure they still understand that substance.
Any last words of wisdom from this group? Thank you all for being so participatory and just in being a part of this conversation. I want to thank you, Adelaide. Highlight our next meeting, September 11th and November 6th. We try to have these meetings at the Fire Academy, but in the Concord area for sure. For those who are CPS, we do offer 2 CUs for today. We just need we need your evaluation, and we'll check off your name to make sure your name is checked off for that. And this is our planning group. If you have any questions, reach out to me. But everyone on the planning team is very active, so reach out to any of us. And thank you all for being here. You guys have a great rest of your summer. It's not over yet. There's plenty more